Injection technique. P-ASA or palatal approach. Anterior superior alveolar nerve block. Before you begin, verify the wand system is set to the STA mode. It is recommended that you use the 30-gauge half-inch bonded wand handpiece for this injection. Please note it is critical to use the STA mode for this injection to ensure that a safe and controlled single flow rate is maintained throughout this injection. Delivering the anesthetic at a faster rate than the controlled flow rate can cause adverse tissue reactions and/or tissue damage. Make sure that the aspiration feature is on, as an aspiration test may be performed during the anesthetic delivery. Site of injection. This injection is initiated just lateral to the incisive papilla along the incisive groove while targeting the underlying nasal palatine canal. The objective is to gain entrance into the canal and maintain contact with the inner surface of the bony wall of the incisive canal. Step 1. Start the P-ASA injection by using the pre-puncture technique. Gently place the bevel of the needle against the surface of the incisive groove. Step 2. Stabilize the needle by applying pressure from the cotton applicator. It is best to use a wooden handle cotton applicator so adequate pressure can be applied. The applicator absorbs any excess anesthetic solution and makes for more comfortable needle entry. Step 3. You now initiate cruise control by depressing the foot pedal and counting 3 audible beeps. After the 3rd beep, the wand system will announce the word cruise. Upon hearing this announcement, remove your foot from the top of the foot control pedal. You will find that the wand system will continue to beep, indicating anesthetic solution is continuing to flow. The technique of allowing anesthetic to contact and diffuse through the outer layers of tissues produces a topical anesthetic effect, numbing the surface. Do not allow the needle to puncture the tissue this time. Continue to allow the needle to stay on the surface for another 4 beeps before initiating needle penetration. Step 4. Rotate the handpiece back and forth birotationally with slight forward movement to allow shallow puncturing of the tissue to a depth of 1 to 2 millimeters. Then, stop forward movement to allow the wand system to continue to deposit anesthetic for an additional 4 beeps before any further penetration of the tissue. Step 5. Continue to very slowly penetrate the palatal tissue with a gentle back and forth birotational movement while simultaneously advancing another 1 to 2 millimeters before pausing once again. It should take anywhere between 8 to 12 seconds to reach bone, depending on the thickness of the palatal tissue. Step 6. Maintain the needle bevel against the surface of bone once it's contacted. You should begin to notice distinct blanching of the palatal tissue as an effect of the vasoconstrictor in the local anesthetic. This is normal and to be expected. Once the needle is within the nasopalatine canal and contacting the inner bony wall, perform an aspiration test. Once the suggested volume of anesthetic solution is dispensed, the needle will be removed.